Well, the president has declared a national public health emergency over the opioid epidemic. He did that just a few weeks ago. And today, a stunning example on Maryland's Eastern Shore. A special education teacher accused of selling drugs on school property. She's now facing a long list of felony charges. Police say they found hundreds of oxycodone pills and capsules of heroin. Investigators were tipped off by an addict trying to kick his habit. It is an example of just how deep the addiction runs in our country. And joining us tonight to talk about this very important, critical topic, Loudoun County, Virginia Sheriff Mike Chapman, recovering addict Nick Yacuob, and the Drug Enforcement Agency Special Agent in charge of Washington, D.C., Karl Colder. Karl, I want to start with you because when you hear a story like what just unfolded in Salisbury, a recovering drug addict tipping off authorities, what comes to mind for you?
Well, it just gives you an indication how this problem has outgrown us as a country. We're seeing it in every town and city in the country. In my AOR, we see it just spanning every area, and it's just a troubling matter, and that's why we have to educate, because now you see it's even in our public school systems. And so education, treatment, prevention, this is what we're lacking in terms of resources.
Well, because you see it up close and personal on a daily basis, are we making progress?
Well, for the first time, I would say the most optimistic point about all this is that people are now talking. It doesn't matter whether you're recovering from this problem, whether you're fighting on the law enforcement side, treatment, prevention. We're all sitting down with our legislators talking about this problem to come up with solutions to solve it.
Sheriff Chapman, there are reports out there that I think there were 64,000 Americans who died last year alone from opioids. That is more than the entire casualty list for people who died during the Vietnam War, Americans who died during the Vietnam War. And Chris Christie, who has chaired one of these organizations, said, listen, if you had 175 people dying every day on American soil and it was a terrorist issue, we'd be doing something to stop it with just the most critical desires. Are we seeing that?
Those numbers are amazing, and what you're seeing here in Virginia, you actually had more people that died in overdose deaths as opposed to car accidents in the Commonwealth of Virginia last year. So it is a huge problem, and what we're doing is taking every angle that we can to try to address this problem as comprehensively as we can. SAC Karl Colder actually brings up some good points, and I've actually worked with Nick Yacuob, who's your other guest here, and we've actually worked comprehensively in Loudoun County, not only to make sure that we're going after the main distributors of this from an enforcement standpoint, but that we're also addressing this through legislative means, through work with our local counterparts or federal counterparts, and other folks like mental health, people that are involved across the board. Legislative-wise, we've certainly worked a lot with Congresswoman Barbara Comstock, and within the state with Attorney General Mark Herring. So we actually are taking a very comprehensive approach at addressing this, and hopefully that'll start bringing the numbers down. I can tell you in Loudoun County, it actually has. We've actually had a 27% reduction in overdose deaths from the same time last year, and we're also seeing a big reduction in just overdoses in general. We said 17% down on overdoses, and then certainly when it comes to pharmaceutical overdoses, we've seen a 50% reduction. So I do think that we can have an impact here, but I think it takes a real comprehensive effort and everybody working together to make that happen.
Nick Yacuob, you are better equipped than anyone else on this panel tonight to speak about not only the dangers involved, but also the possible ways of getting us off the brink of this crisis.
Well, I think it's very important to keep in mind that these are people first. I'm a person in long-term recovery. This time next week, I'll actually be celebrating 10 years of continuous recovery. Opiates were some of the drugs I used along with heroin. But the big thing was going out there and asking for help. Look up your local community services boards. You can look up 211 and try to get resources that way. Try to get into treatment, try to get into detox, and ask for help. Seek out the local recovery community. That's always a big thing. Finding other people in recovery and, trying to seek the help from them. And, that's the way I did it. That's the way almost everyone I know does it. You know, there are very few people that are capable of actually beating this disease on their own, and it is a disease. A lot of people are divided on the idea of it being a moral failing or a matter of willpower, and that's just simply not the case. It's been labeled a disease since 1956, I believe. Yeah, 1956 by the American Medical Association. It's
Well,
chronic,
Nick,
meaning lifelong.
you and the sheriff and special agent all chime in on this. Feel free. But as we talk about how government can or can't help solve this issue, one of the solutions people have proposed is having Congress consolidate a lot of the resources. So, for example, you have block grants. You're sending money to states with other abuse programs, letting them kind of on the ground direct how people like yourself and people that the sheriff and the special agent in charge are seeing on the streets all the time. Is that the answer? Is that the way the federal government, the president, Congress can really make a difference?
I think so. I think a comprehensive effort, as I mentioned, and certainly what we were able to do is equip all of our deputies with Narcan. And as a result of that, we saved 10 lives last year, just the sheriff's office alone, and another 5 so far this year. And that's in addition to what fire and rescue has also done. So just the ability to have that kind of capability of the drug, the naloxone with us in order to do that, that's one of the things. But I do think, again, with assistance from the federal government, anything that we can do to comprehensively attack this and address this issue collectively is really the best way to go.
Special agent, is the DEA getting the federal tools and the resources it needs?
Yes, but we can always use more. But the main thing here is recently there's been a strong push to regulate the substances used to produce fentanyl. And at this point in time, all the substances that are produced relative to fentanyl are now going to be scheduled and basically emergency scheduled. And that's important in combating this synthetic opioid problem.
Yeah, classification and scheduling can make a big difference,
yes.
right? But
Big
Nick,
difference.
I've got 15 seconds here. Give me a reason to be optimistic that we're tackling this thing properly.
There absolutely is hope. And, like it was said earlier, we have many people from many different walks of life all coming together to talk about the opioid crisis. Law enforcement, people in recovery, people in government, people in the mental health and substance use disorder field, people from the religious community, et cetera, et cetera, et cetera. Everyone is coming together to talk about it.
Nick,
If you're out there and you're
congratulations on
struggling,
your sobriety. We appreciate your
Thank
being
you.
here tonight. Gentlemen, thanks so much for your efforts every day on the streets and trying to combat this crisis that eventually we're going to have to tackle in a way that we haven't with anything else in a very long time. So thank you to all three of you. We've got to take a quick break now. We're going to be right back with a look at the Iran nuclear deal. Will the White House honor it, along with a status update on Iran's compliance? Meanwhile, streaming online, we connect with Congress, straight to the source on the prospects of tax and healthcare reform.